In Japan, a deep cultural expectation exists that children care for their aging parents. But as younger generations move to dense urban centers for work, that physical separation creates an isolating reality for the parents left behind. This geographical divide is colliding directly with what policy experts call the 2025 problem. This year, the massive post-war baby boom cohort reaches age 75. This sudden surge in the older demographic places an intense, immediate strain on an already stretched care system. This chart visualizes the growing gap between the expanding 65-plus cohort and declining supply of human care workers. With nearly 30% of the population over 65, the numbers reveal a secondary crisis. 40% of these older adults report feeling isolated. The sheer scale of this isolation has pushed the issue to the highest levels of government. Mitigating elderly loneliness is now a cabinet-level priority and a core pillar of Japan's public health policy. The math is clear. There simply aren't enough human workers to provide constant visit-based care. The system requires a technological bridge to fill the gap. Aiko is an AI voice companion engineered specifically for supervised adult daycare facilities. It provides continuous daily conversation and engagement for older adults in a safe, monitored environment. Until now, care facilities have often relied on therapeutic robots, like the ParaSeal seen here, which offer comfort but are limited entirely to nonverbal interactions. Aiko uses a large language model, an AI architecture trained to understand and generate human dialogue, that is fine-tuned to simulate the specific personality, voice, and memories of the user's living child or grandchild. By giving the AI the voice and shared history of a loved one, Aiko bridges the physical distance between generations, offering a personalized connection that actually feels familiar. The setup begins with the family. Adult children remotely record a short voice sample using a secure app and answer a questionnaire detailing shared memories, mannerisms, and relationship history. For the older adult, the technology is completely invisible. They interact through a simple, voice-first interface, speaking naturally without needing to navigate complex touchscreens or menus. This diagram maps the conversation loop in action. The elder's spoken input flows into the LLM, which processes the context against the shared family history and outputs a response synthesized in the exact voice of their grandchild. Over time, this daily interaction loop captures the older adult's own stories. Families can upload photos, and the system uses those captured memories to generate personalized video stories narrated in the user's familiar voice. Because the conversation relies on genuine shared history rather than generic chatbot responses, users are far more willing to engage with the technology every day. To ensure these interactions remain safe and beneficial, Aiko is deployed strictly within supervised adult daycare facilities rather than isolated home environments. Here, we see the platform's synchronized infrastructure. Every interaction links the elderly person's voice interface, the family's mobile portal, and the facility staff's operational dashboard to share real-time data. This operational model is currently moving through working prototype phases, with initial pilot programs launching in partnership with care facilities here in Okinawa. For the facility operators, Aiko provides immediate relief. The AI conducts conversational engagement, saving staff time, while the dashboard flags changes in mood or memory, generating alerts for professional follow-up. Integrating this technology directly into the facility workflow creates a unified care ecosystem. The institution and the family are suddenly equipped to share the caregiving burden. Simulating the voice of a living family member carries significant ethical weight. Doing it safely requires a highly specialized, tightly controlled software architecture. This 3D architecture model illustrates the core processing stack. Voice data enters through the user interface layer and passes exclusively to the companion intelligence LLM, fine-tuned strictly on specific family data. Above that is the personalization and memory layer. This isolates and protects the individual user's relationship history. The next layer contains strict safety guardrails, actively blocking prohibited topics. Finally, the foundational data and privacy layer ensures absolute compliance with Japan's Personal Information Protection Act. This modular, defense-in-depth architecture ensures the system is not only capable of natural conversation, but ethically and legally viable for vulnerable older adults. The persistent gap between older adults in care settings and their adult children working in dense urban centers like Tokyo is a structural reality of modern Japan. By enabling continuous daily check-ins, Aiko changes how we approach care, moving from reactive emergency responses to a model of consistent, proactive support. For the family, this creates a profound psychological shift. It mitigates the guilt associated with unavoidable geographic and professional constraints, offering genuine peace of mind. Aiko uses complex voice simulation as an emotional lifeline, sustaining an elderly person's independence even when their family lives hundreds of miles away.